Welcome. I'm going to ask Dr. Shah to start us off for this hopefully final press briefing on COVID-19.
Thank you, Governor Mills, and good afternoon, everyone. I'm Nirav Shah, Director of the Maine CDC. I'm delighted to be joined this afternoon by Governor Mills and Commissioner Lambrew from Maine's Department of Health and Human Services for, as what Governor Mills just noted, is our last regularly scheduled briefing on COVID-19 here in the state of Maine. I'll begin and then turn things over to Commissioner Lambrew and then over to Governor Mills. As of this morning, we've logged 69,033 cases of COVID-19 in the state, an increase of 12 cases since yesterday. Cumulatively, since the beginning of the pandemic, 2,077 people have been hospitalized. And right now in Maine, 30 people are in the hospital with COVID-19. 18 of them are in a critical care unit, and 8 of them are on a ventilator. Overall, 850 Mainers have died with COVID-19 since the beginning of the pandemic. Our positivity rate continues to be stable. Right now, it's at about 0.081%. And our testing volume for PCR tests over the last 7 days is at 191 per 100,000. The Maine CDC, since the beginning of the pandemic, has distributed now 7.3 million pieces of PPE to hospitals, healthcare providers, and community groups across the state of Maine. To put that in perspective, that's more than 5 pieces of PPE for every single person in the state. Cumulatively, to date, we've administered 1,529,764 COVID-19 vaccines. To translate that into people, it means that as of this morning, 90% of Maine people over the age of 65 are fully vaccinated. And about 70%, 69.1 to be exact, of Maine people who are eligible for vaccination are fully vaccinated at this point. And 61% of the entire population of our state has been fully vaccinated. Before I turn things over to Commissioner Lambrew, I wanted to take a moment to reflect on where we've been and where we might be going. We began here in this room where it happens about 16 months ago. Now, 190 briefings later, we're all a bit wiser, at least about COVID. Much has changed in that time, especially in the rhythms of daily life. Many things are constant, such as the collective grief that we feel for those who have died. Our sense of sorrow for the 858 families in Maine that are one person poorer now than they were before COVID is something that will never go away. But as COVID eases, the daily rhythms are returning to a familiar cadence. That's a good thing. It's the reason why the state of emergency, as well as these briefings, are ending. Now, pandemics don't end with the expiration of a declaration. Rather, they end with a prolonged exhalation. That's the case here. Though the emergency ends, COVID continues. There will continue to be cases of COVID. There will continue to be outbreaks of COVID. There will continue to be hospitalizations and, sadly, deaths. But how much longer, with what intensity, and with what impact on our state and on our lives? Well, that's up to us, and specifically, how many of us get vaccinated. That is what we'll be focused on going forward. Not everyone has been vaccinated in Maine by chance or increasingly by choice. Our job now is to figure out who hasn't been vaccinated in Maine, why they haven't been vaccinated, and what, beyond a chance to win about $900,000 in the hashtag #VaccinationLand sweepstakes, might prompt them to get their shot. The vaccines are key here, and we have undersold their effectiveness. The COVID-19 vaccines have fundamentally altered our relationship to COVID-19. A year ago, our lives revolved around the virus, like the earth around the sun. But now, for those who are fully vaccinated, the virus effectively revolves around them, unable to cause much harm. The fully vaccinated can now regard COVID-19 as they would other respiratory viruses, something to be aware of, but not something to be afraid of. They say that hindsight is 20/20. And when it comes to COVID, that is true in more ways than one. As we get back to normal, or something akin to normal, we can certainly learn from 2020. Getting back to normal has been our goal, but perhaps it's not the right one. It is, after all, normal that got us here in the first place. Our next step should be to strengthen what has served us. Our spirit of community, the understanding that we are all connected, and the recognition that none of us is an island. Here's the thing. Not only has Maine fared well, we've done so amid projections from those who feared that we might not. Those who looked at our oldest in the nation demographics and predicted higher case numbers and more deaths than we've seen to date. But thankfully, neither has been the case. The obvious question for historians of the pandemic will be why and how. How did Maine get where we are today? There's a proverb in my mind that sums up how and why Maine fared comparatively well in the face of a pandemic. If you want to walk fast, then walk alone. But if you want to walk far, walk together. In Maine, we walked together, and as a result, we walked far. And it has been my honor to be on this walk with you. Now, before I turn things over to Commissioner Lambrew and Governor Mills, there's a few people I'd like to thank. I'd like to take a moment to thank our interpreters, Josh, Dr. Thibodeau, and the entire team at Pine Tree Society for making our messages accessible to all Mainers. The next person I'd like to thank is someone who has been by my side since before the very first briefing and hasn't left it ever since. A man whose job it is to literally put words in my mouth. That is my friend, Robert Long. Robert is no doubt mortified that I am mentioning him, but that is pretty much characteristic of his humility. If you have, by any chance, over the past 16 months, heard me utter a memorable phrase, odds are that Robert Long wrote it. Robert has been, for so many of us, a mixture of sounding board, speechwriter, media wrangler, close advisor, and friend. Now, Governor Mills and Commissioner Lambrew and I are just a few people amid a cast of thousands across the state that have worked on COVID. People across the state who stepped up by finding new ways to help, by doing things they couldn't have imagined themselves doing in 2019, by checking in on their friends and neighbors, by doing grocery runs for those who couldn't get out, by volunteering at polling sites to make our election safe, by volunteering at vaccine sites to greet people, to guide people, to ease the anxiety of people who were leaving their houses for the first time in a year. I'd like to take a moment to thank each and every one of those Mainers for their dedication in helping others during the pandemic. At the end of these briefings, at the end of each of them, I've encouraged Mainers to be kind and take care of one another. Those Mainers who have stepped up to help have found ways to do both of those things in their communities. I'd also like to take a second to thank my wife, Kara, for keeping our family together, for keeping me sane, and for keeping me and our dog alive. We all relied on someone during the pandemic. And for me, that was her. I'd also like to close by thanking the people of Maine for thinking about history. Mainers should be proud of what we are all doing in our response to COVID. We faced the worst that nature had to offer and responded with the best that humanity could imagine. Finally, I want to thank the people of Maine in one last way for welcoming me and my family to our adopted home state. We've lived in Maine for 2 years now, which means that one of every 4 days that I've lived in Maine, I've spent talking with Maine people about COVID-19. I don't know most of you, but I feel like I do. The most meaningful piece of this to me is the fact that someone new to Maine, a guy from another state who's only been here for 2 years, could come to be viewed as someone to tune into. To me, that says a lot more about the character of Maine people than it does about me. Thank you all very much. Commissioner Lambrew?
Well, I will begin by thanking Director Shah. His leadership, professionalism, partnership, and friendship has meant the world to myself, my team, our different departments, as well as our residents here in Maine. I think it's also important to remember that COVID-19 is not just a public health challenge. It spilled over into the health and long-term care systems in Maine. Our hard-working health professionals had to change the way they practiced, donning PPE, setting up COVID wings, and caring for patients and residents who were not just affected by the virus. They were harmed by being separated from their loved ones at a time when they needed them most. We thank each health professional for their work during this pandemic, as well as the families who supported them. COVID-19 first responders included many outside the healthcare system as well. Towns and cities helped educate the public about masks and distancing through the Keep Maine Healthy grants. Businesses followed the COVID-19 prevention checklists to keep their employees and clients safe. Community-based organizations have been the department's boots on the ground, providing tailored education, support, and vaccination clinics to our diverse residents. And volunteers turned out in droves this spring to help at vaccine clinics that popped up, large and small. On behalf of the entire Department of Health and Human Services, whose staff put in an all-out effort during these past 16 months, of which I'm immensely grateful, I thank you. COVID-19 also has spun off mental health and substance use disorder challenges, some of which persist today. Concerned about the disease and the people who suffered from them, concerns about losing income and jobs, the pressures of learning and working remotely, and recovery itself have been tough. But our team at the department and Maine healthcare providers, again, have been meeting the need with creative and aggressive behavioral health interventions. For example, our Strengthen Me initiative will be extended and expanded to provide free anonymous help to people in Maine during this new phase of the pandemic. Strengthen Me is just one example of the kind of support that will continue even as the state of civil emergency ends. Our fight against COVID-19 is not yet over, which is why we'll continue to help Maine people get back to work, find affordable childcare, get COVID-19 testing, and if they test positive, support them in staying at home and limiting the spread. But before I turn it over to Governor Mills, I also want to add my thanks to her. Governor, your leadership from the start of this life-changing pandemic has been strong, steady, and compassionate. At each turn, you demanded a thorough review of the science, the options, and their implications. And you balanced your approach to public health with other considerations that led the state of Maine out of this emergency into this strong position. I thank you, and I turn it over to you for remarks.
Well, thank you, and good afternoon. Finally, I'm today announcing the end of the state of civil emergency, which I had first declared on March 15, 2020. It is time. It's not that we've cured a disease or that we've banned the virus or removed the pandemic forever from our lives, or that we've thrown caution to the wind, or that everything now is exactly as it was 16 months ago. But the state of civil emergency is no longer necessary. It is over, and it is time. Last night, I returned to the office late in the evening, poured over some files, letters, notes, orders, and thoughts, remembering the hundreds of decisions we've made from day one of this crisis and reflecting on the 80 executive orders drafted in meticulous detail with able legal counsel, the 190 news briefings held by our CDC and other members of the administration, the 116 so far White House briefings, phone calls, Zoom conferences under two different, very different administrations during a tumultuous election year. And so many other events and decisions that consumed our attention entirely and rocked the world. Dr. Shah and Commissioner Lambrew stood by my side 16 months ago, and they stand with me again today. I could ask for no better individuals to lead our state through a public health crisis of unfathomable dimensions. But from the first day we spoke of this, these two individuals, more than anybody else, anchored all of our conversations and thoughts and decisions in science and in research of the best and highest order. They never shirked from their moral obligation to tell the people the truth. They stood before the people of Maine for well over a year now and looked them in the eye, told them straight up what everybody needed to know, good, bad, or indifferent. You have done so with kindness, with heart, with humor. I don't know if that was Bob's or yours. I suspect a lot of it was yours. Coldplay, really? and you told us everything we needed to know, even never glossing over any disturbing news. You've been the beacon of hope for Maine people throughout this pandemic. And without both of you, we wouldn't be here today. On behalf of this administration and on behalf of the 1.3 million people of the state of Maine, we thank you. I also want to thank Maine Public for bringing these broadcasts to the people of Maine, and thank our interpreters as well for making these briefings accessible to everyone. Nearly 16 months ago, joined by Commissioner Lambrew and Dr. Shah, before we had become familiar with things like PPE, PPP, PCR, positivity rates, herd immunity, swab and send, antigen tests, flattening the curve, or N95s, I announced a state of civil emergency. It is only fitting that we join together again today to end it. I've received thousands of emails and handwritten notes and letters from Maine people during these last 16 months. I've read them. I've learned about people's lives, listened to their hopes, prayers, and heartaches. Some of those messages have stayed with me a little longer than others. One young mother has written to me just about every week since the beginning of the pandemic. I know she's been so busy teaching her children at home, keeping a small business going with her husband, training the family dog, birthing goats in the spring. I recently got her last letter, where she recognizes the waning days of the pandemic. She wrote, quote, "While many people just want to see the pandemic behind them and forget the whole of it, there are also those of us who will let the emotions and lessons stay with us. The experience is one that shouldn't be forgotten," end quote. I will be forever grateful to her and to thousands of other Maine people for extending their hands, their hope, their hearts to my staff and to me during this pandemic. Thank you, Ashira. And you're right, we should never forget the lessons of this pandemic. We can never forget how people of all faiths learned to worship in new ways, or how town and state officials found creative and effective ways to protect our precious right to vote, or how school bus drivers, teachers, parents, and volunteers delivered thousands of meals to school children, along with homework. or how the Maine Coast Fishermen's Association, the Maine Department of Agriculture, and others stocked the shelves of hundreds of food pantries across the state. Or about how the federal government and members of our congressional delegation came through for us with PPP and then with coronavirus relief funding. Or about how lawyers and advocates and housing officials helped hundreds of families avoid eviction. During this pandemic, we've learned the depths of devastating loss. We've endured the loss of 858 lives in Maine, taken by a deadly terror that invaded our state, our nation, and indeed the world. Their loved ones were unable to mourn together. Funerals foregone for small, hugless gatherings. Other major life milestones were marked quietly, without fanfare, if celebrated at all. Graduations in parking lots, weddings postponed, birthdays by car parades or by Zoom. We lost normal life as we knew it. Souvenir shops, water slides, agricultural fairs, auto races, church services, baseball, football games. All were drastically modified, transformed, or canceled. Children moved out of the classroom and into their living rooms to learn as best they could. Our border with Canada closed down. Families in the county and down east often prevented from seeing their loved ones just across the waters in Canada. Hotels and stores operated with unheralded losses, while lunchrooms in popular restaurants were limited to takeout and curbside pickup. And then we lived through the explosion of the J. Paper Mill's giant digester, which blew up in broad daylight, threatening the lives and livelihoods of thousands. So let's pause for a moment of silence for all that we have lost, and in solemn recognition of the thousands of people sickened and hospitalized with this deadly virus. I think if I do the math right, 69,000 people tested positive. That would be 1 out of every 20 people in the state of Maine. Let's pause and think about them and the 858 who lost their lives, and the families whose loved ones are no longer with them. Thank you. That pain may never fade, but we have and we will persevere. To paraphrase William Faulkner, we will not only survive or endure, we will prevail, and we have prevailed as we learn the true meaning of courage, pivoting, and adapting in the face of adversity. Like other states, my administration declared a state of civil emergency at the first sign of the pandemic, March of 2020, quickly rallying all the forces to help people suffering job losses, to get food to families, to build out our team of health professionals and protect Maine people from this dangerous virus in every way imaginable. In partnership with the legislature, we passed emergency legislation to respond to the crisis. I thank the members of the legislature for putting aside politics and helping Maine people. We distributed more than $1.25 billion in federal aid to support Maine's economy and sustain people in tough times. Our actions then and now stabilized the state budget and secured revenues to spur economic recovery after the pandemic, even while other states have suffered catastrophic economic loss. In the year and a half that has followed the declaration of the state of emergency, we've implemented public health and safety measures, dialing them up and scaling them down when circumstances and science demanded it. The adjustments we made to meet the challenges of a new and changing virus would not have been possible without the commitment of Maine people. We asked you to stay home. We asked people to wear masks. We asked them to watch their distance and avoid large gatherings. And you did. We asked for help from the private sector, and they answered. With courage, Maine people learned to do what they thought they could not do. Nurses, doctors, long-term care workers, bus drivers, teachers, ed techs, volunteers, small business owners, working parents, stretched to the nines. Delivery drivers, grocery store clerks, fishermen, haulers, and farmers, so many more unsung heroes who saved lives and kept our state moving forward. Innovative companies like IDEX, Jackson Labs, Puritan, Abbott, LL Bean shifted to give us tools we needed, including testing materials from IDEX when testing was so very scarce. They saved tens of thousands of lives in Maine. They helped us fight back in those early dark days of the pandemic when vaccines were so far away. Other companies like barbecue manufacturer Maine Source Machining switched to manufacturing ballot drop boxes designed by members of the community colleges. Breweries and distillers like Maine Craft Distilling shifted to producing hand sanitizer. American Roots, LL Bean, Flowfold produced face masks and face shields. I don't know how many people have sent me face masks in the mail, all custom made, individually designed, people who know much more about using sewing machines than I would ever dream of. Lee Auto produced public service ads and the Chamber of Commerce as well on public health precautions. Bangor Savings funded internet devices for school children who didn't have them. That's Maine people working together, and that's perseverance. Because of the steps you all took to protect yourselves, your loved ones, and your fellow Mainers, we have maintained among the lowest rates of COVID-19 cases, hospitalizations, and deaths, and the highest rates of vaccinations across the country. The collective efforts of a people and their government have worked. We've also learned we cannot take our health or our progress for granted. The pandemic is not over yet, especially for those who remain unvaccinated. As Dr. Shah has noted, the Delta variant is spreading dangerously. Nearly all of those hospitalized in Maine right now suffering with COVID-19 are not fully vaccinated. And I want to be clear, the end of the state of civil emergency is not the end of the pandemic. My administration and medical providers across the state encourage everyone to get their shot. It's the best way to protect your health and that of your loved ones. In addition, if you're not yet vaccinated, you have until midnight tonight to get at least one dose of COVID-19 vaccine and register to win almost $1 million under our vaccination land sweepstakes. Please roll up your sleeves, get your shot, and get a shot at winning a lot of money. I also want to take a moment to thank from the bottom of my heart the other members of my cabinet, the best cabinet and the best team in America. Pender Macon and Heather Johnson and Peter Rogers and Doug Farnham and so many others who have been with us and brainstorming day after day for 16 months, problem solving every step of the way, never becoming so discouraged that they would throw up their hands, but always saying, I'll help solve this problem. And they did. And the 12,000 state government employees, people at the Department of Health and Human Services, the Maine CDC, Maine Emergency Management, the Maine National Guard, all at the core of our COVID-19 response. Employees at the Department of Education, who ably guided school staff across the state in educating children while protecting their health. And the employees at the Maine Department of Economic and Community Development, who listened to thousands of complaints and tried to solve problems every step of the way, trying to balance challenges to the economy with a deep challenge to public health. You know who you are. Those people went to work every day with determination and compassion to do what was right and protect the lives and livelihoods of Maine people. And I'm so proud of them and so grateful for every one of them. We still have work to do, challenges we need to tackle together, like building back a strong economy where all Maine people can succeed, like addressing the sharp increase in drug overdose deaths, and getting all kids back in the classroom this fall. We can and will do this together, just as we persevered this far. So I'll end in the same way I started, by sharing the words of another Maine person. This friend and former poet laureate of Maine wrote to me recently to share something he had just written. It relates to a photograph you all saw taken by Lois Griswold, a photo of a chain of people who linked arm to arm to save a drowning man last summer off the York Beach. He dedicated this poem to our staff, and I dedicate it to the people of Maine. It's called On the Rocks in the Pandemic by Wes McNair. Who are they? Where did they come from all of a sudden? These men flung together on the rocks of the distant shore, grasping hands. Some without shoes, another who swam for the distressed diver, shirtless as he reaches out his arms to start the chain with all the rest, all strangers, yet intimate in a way their bodies know. The young man near the front, twisted back towards the diver. The old man midway, spreading his legs to lean far enough in the opposite direction he could fall, except for the shared balance of their anonymous human will and compassion and togetherness. One to the next, and the next to the extended hand at the edge of the photograph, and to all the other hands we cannot see. Thank you, Wes. Extending our collective hands figuratively toward one another during this pandemic, we learned together we can survive the unimaginable, and that we can rise to be an even stronger people, and a stronger state. Those are some of the lessons I will never forget. From the bottom of my heart, thank you all for all you've done to keep yourselves, your loved ones, and your fellow Mainers safe. As always, it is my great honor to serve as governor of this great state. Thank you. Now, among the things that he would say at press briefings, he would use some cute expressions to bring it home what the pandemic was all about, from, citing Coldplay and fun songs like, I got a. He would also use the term, he said, the virus is like glitter. Oh, yes. And so I raided my granddaughter's toy cabinet to provide you some special effects.
Thank
Hopefully
you,
we'll never have to use them
let
again.
us never open them.
Oh no. Oh yes. Take that home.
Thank you, Governor. Thank you very much. Thank you. It's been an honor.
What are you drinking?
I'm not going to say it on TV.
So, be happy to take a few questions.
Yes, I think we'll open it up to questions. We don't have a list today, so.
Go ahead, John. We have time for a few. Could you give us your take on what the Delta variant may mean for Maine? I mean, other places where things have been going well, they've had to reinstate masking requirements. So, what's the likelihood that could happen here?
Sure. Good, sir. Yep. Thanks, Patty. I guess fitting that I'm carrying 2 tubes of glitter because that's somewhat emblematic of what the Delta variant could mean. Let's start with where we are. As of the latest round of genomic sequencing that we've completed, we've still only identified 4 cases of the Delta variant. That's as of Monday. But based on what we've seen in other parts of the country, other parts of the globe, there's a chance that the Delta variant will come here. Now, what does that mean for people? Well, thankfully, the vaccines that we have, including even the Johnson & Johnson vaccine, have shown good effectiveness against the Delta variant. And coupled with our already leading the nation rates of vaccination, if the Delta variant comes here, for those who are vaccinated, it will not necessarily change the way that they've gone about things. But for those in Maine who have not yet been vaccinated, the Delta variant has the potential to spread, particularly in large pockets of unvaccinated places in Maine, certain counties where vaccination rates are lower than they are elsewhere. That's a concern. That's a risk. As I mentioned earlier, one of the next tactical things on our agenda is to sort through why folks in those particular regions have not yet been vaccinated and what we can do to bring them along. The Delta variant is a risk, but it's not one that we are not in a similar risky position as our other states because of the favorable vaccination rates we've achieved.
The civil state of emergency allowed you to issue a number of orders, everything from requiring businesses to only allow takeout and delivery.
Yep.
Are you open to reissue a civil state of emergency in the future should cases continue to spike back up?
I don't anticipate that prospect. I think it highly unlikely. I hope and think it's highly unlikely.
I have a question about on the Delta variant. Yeah, so we're gonna pause there for a minute.
It's hot.
I know it's really hot in here. If anyone needs to take a minute to get a little water.
Needs water.
Please.
You can leave that door open, maybe a little air too.
Water.
She's all set. Alright, go ahead, sorry.
Okay, that's okay. No, so I was going to ask with regard to the Delta variant, I saw like the World Health Organization is recommending that even vaccinated people wear masks to protect against the Delta variant. What are Maine CDC's thoughts on that? Should even vaccinated people still wear masks indoors because of the variant?
So in recent days, there have been some discussion, both based on some statements that an individual from the World Health Organization made, as well as some changes that LA County have made around masking for those who are vaccinated. I've actually had the chance to speak with federal health officials, as well as with one international health official who's very familiar. Let's start with the WHO's comments. What the WHO noted, with one official from the WHO noted when he made those comments, is he was really referring to places in the world where vaccination rates are 1 or 2 or 3%. When it was followed up with him about whether that would apply to places like Maine where vaccination rates are high, he actually said, no, I think you should stick with what you're doing there. Similarly, I've spoken with the senior official at the CDC on the same topic, and there too, where vaccination rates are high, as they are in Maine, the science shows that the vaccines work. And so based on that, we are not changing our guidance, nor is the US CDC. So I do not, as we are in this room, for those who are fully vaccinated, the vaccines work and they work exquisitely well.
Dr. Shah, you mentioned previously that you think we've undersold just how truly effective these vaccines, and I know that you've also mentioned that hindsight is 2020. But is there anything that you wish the state would have done differently?
Mel, I think we're still in this. To be fair, we're still in the midst of the pandemic. Although the state of emergency is ending, there's still more to do. I think, Mel, one way to think about that is our outcomes speak for themselves. Now, certainly there has been 858 individuals who have died, over 2,000 who have been in the hospital. But from the things that were within our control, quite pleased with the decisions that we've made. I think it's too early to speculate as to what we could have done differently from a policy perspective. There will certainly be a time for that. A standard part of any emergency activation is the after action, the analysis of what happened and what could have been done differently. I have no doubt that we will uncover things that we will be able to do differently in the next time something of this nature happens. But for right now, we're still in the midst of it.
To schools and child care centers, I was wondering if you could address what is recommended for settings where there's a number of children who are unvaccinated with the mask mandate being over with the state of emergency.
Sure.
So we continue to use the US CDC guidelines as our kind of recommendations for our Maine-based schools and childcare centers. The US CDC does recommend that people who are not fully vaccinated wear masks. That includes in these settings. But we are hopeful that as we go back this fall into in-person learning, that we will see the vast majority of our school staff fully vaccinated. We're working on our 12 to 18-year-olds for the older youth. And we feel that the public health protocols that served us so well last year will continue to protect those children. So we're going to maintain the course of a strong set of guidelines and recommendations for childcare settings and schools in the fall, as well as a pooled testing program, for example, that will every week for the participating schools check to early detect COVID-19 so we can quickly isolate those children or staff and keep our schools safe.
Yeah, I think this question of testing for Dr. Shah. What role do you think testing will play in the weeks and days ahead as moving forward? And whoever feels most.
Yeah, sure. I mean, testing will remain a critical tool in our fight against COVID-19 because, as I just said, what it does is it quickly detects whether or not somebody has allergies or a cold or this fall the flu or COVID-19, which allows us to quickly intervene. Isolate that person to make sure that other people are safe. And now, as we have an increasing set of therapeutics, make sure that that person gets the kind of healthcare that they need. We will continue our efforts here in the state of Maine. Our mobile lab will continue to function at the state level. We'll continue our testing partnership with Walgreens so that the 65 Walgreens throughout the state of Maine, somebody can go and get a rapid test at no cost. We'll continue to support our schools in the summer, our camps in testing. And we have just today announced that we're going to increase our testing or surveillance testing at nursing facilities because we want to make sure that until we feel like this pandemic is truly behind us, we're giving people the information they need to protect themselves and their communities.
I'll add just one thing on the testing front. I absolutely concur with what Commissioner Lambrew noted. One of the things that we've been keeping our eye on testing is how it's changing across the state. Testing has come down. That's to be expected. Those who are fully vaccinated need not be tested regularly unless they have symptoms that are consistent with COVID. That's understandable that our testing volumes have come down. They've come down nationwide. But one of the trends that I've seen in the data is that testing volumes have come down even more in places that are not vaccinated. Put that differently. Places that are well vaccinated, like Maine, have continued to test at high rates. That's how it should be. The opposite is concerning, though. Places that are not well vaccinated should still be testing at rates similar to before the vaccines, but they're not. I'm looking for those same trends within the state of Maine as well to see, again, if folks aren't going to get vaccinated, at least we can make testing as easy as possible in those places.
Hi, in regard to the sweepstakes, how helpful has it been in getting people vaccinated?
I think, well, there are thousands of people who got vaccinated in the last few weeks, 12,000 at least, since we don't know, we didn't ask every time, did they get vaccinated because of the sweepstakes, but clearly more people got vaccinated. So every additional person vaccinated is a success in our book. And we think it's fun too. It's federal money, and somebody's going to be rich, and you have until midnight tonight to get your shot.
Justin, you want to
Pivoting to the work that you're having Casey family programs do in the state,
Yeah.
Governor, what's the latest on that, and are you having them look for anything specific?
On a separate issue on the child cases. Go ahead, please.
Yeah, so we are working with the Casey family programs to do a review of recent child deaths as well as practice patterns and what else might be changed in the short term. We expect those results in a short term, meaning several months, not a year, not longer than that. And their goal is to look broadly, not just at child welfare, but at our public health and health systems to find out, again, if there's any patterns or practices that we should change as soon as possible. But as we announced last week, we're not waiting. We continue to look at all of our different interventions. I mentioned the Strengthen Me initiative. We're expanding its scope. We're extending it. We're looking at all of our substance use disorder policies, partly because we just saw the report on the record high overdose deaths in Maine in 2020, with 2021 being on track to be higher. So our work is far from done. And that is partly because we're trying to make sure that as we move out of the pandemic, or paying attention to any of the post-traumatic stress that might be incurred by our Maine families.
All right, thank you, everyone.
Thanks. This is yours. Can you get that?